Well, this week we are diving deep into sleep. We've gone over several different things that may be keeping you up at night and what to do about them. However, for millions of Americans, those tips are just not enough, and those Americans suffer from chronic insomnia. Remember the goal? The National Sleep Foundation recommends adults 18 to 64 get 7 to 9 hours of sleep. But some people get much less because of chronic insomnia.
1 in 10 people have chronic insomnia, and that's difficulty falling asleep, staying asleep, waking up too early, at least 3 times a week, and happening for at least 3 months.
The exception is when you've had a significant life event disrupt your sleep.
So going through a change in job or a stressful event at home, some people will have insomnia for a couple weeks or months, and then it resolves on its own.
When it's happening, there are consequences. It affects your mood, which can impact your social life. It makes it hard to concentrate at work, and your productivity suffers. Your memory lets you down, and after enough sleepless nights, you begin worrying about sleep, and the worry keeps you up.
And that leads to feeling unrefreshed, feeling perhaps even a little bit more depressed or fatigued, and then it has some health risks.
And those health risks can be serious.
It's like increased risk for obesity and diabetes.
That there may be some links there in the long term to Alzheimer's.
Health risks also include heart attacks, high blood pressure, and stroke. If you're a woman, older adult, have a medical condition, or take medications, you may be more at risk for insomnia. We consulted many different sources for information about sleep problems, and almost every single one pointed back to one solution: cognitive behavioral therapy.
Cognitive behavioral therapy is a set of techniques that helps people learn how to relax in the evening and also helps regulate your biological rhythm to get your sleep back on track.
There are several ways you can learn about CBT. There are good resources online, but the best move is to talk to someone, preferably a trained sleep specialist from an accredited sleep center. Check behavioralsleep.org for specialists in your area. Most insurance will cover this therapy.
Most people do improve. It's thought that 75 or 80% of patients who go through this treatment, which is pretty short, it's 6 sessions, but about that many will improve with this treatment and have a remission of their symptoms.
If you take sleep medications and they don't help, CBT can be the answer.
My favorite type of patients to see with this technique are people who are taking sleep medications and they're still not sleeping, and so they're getting all of the side effects and they're still not having the effect of the medications.
Even your child could benefit.
It's been shown to be effective in older adults, in younger adults, and children, so really across the board.
At Children's Mercy, they make sure a child has a good sleep schedule and no sleep apnea. Then they also turn to CBT.
If all of that's under control, then usually we're talking about what can we do from a behavioral point of view. Many times reframe how they think about sleep to help with their insomnia, and that is usually the best treatment for insomnia.
The other 2 doctors we spoke with this week agree.
But it is, in fact, the most effective treatment.
If I had 75 or 80% chance of getting better, I would probably want to try that treatment. It's usually worth a try.
For most, a first step is a sleep study, and there are many places to go in the Kansas City Metro. So tomorrow we'll take you to North Kansas City's hospital's Sleep Center, and you'll see what's involved and how it could help you. And we'll talk about sleep and kids on Friday. Meantime, read more about cognitive behavioral therapy at fox4kc.com/sleep. And sleep and kids sounds like a great subject for a couple of us here, right, Carly?